rack pull. So we got our squat rack set up with our safety pins. And for me, I have the bar set up to be just below my kneecaps. And so this is gonna look a little bit different for everybody, depending on your tissue's capacity, what your training history is like, if you have an injury that's ongoing, those types of things. So least aggressive is gonna be higher, obviously, because you're not bending over as far. More aggressive is gonna be closer to the ground. We usually kind of go through a progression before we even get to this position. But when we go through a loading progression, before we increase the weight, depending on our intent, but we typically like to change our range of motion before we bump the weight up. So say I started with a rack pull just above my kneecap, right? Going through the rack pull with perfect technique. Maybe that happens for a week or so of doing a similar position so that my joint angles are the same. And then I lower down one pin, so now I have a little bit more range of motion. And I keep doing that until I hit a desired depth, and then I come back to a higher position and add weight. But again, this can look really different depending on what stage of training you're in, if this is for performance, if it's for rehab, all those types of variations. But today, I want to talk more so about your technique and your setup. So as always, breathing and bracing, that's where we want to start. So our diaphragm breathing is setting air through our belly to create expansion and stability in our lumbar spine. So when we do that, we want to prevent the cueing of overextension of our lumbar spine and just squeezing our shoulder blades together. We want to get used to reaching toward the floor as hard as you can to feel your lats engage. You'll feel your chest fire as well. And then taking a big breath in through your nose to feel your belly expand. When our belly expands, we get increased intra-abdominal pressure, which is going to allow us to have more stability through our spine, because we're trying to prevent the compensation of just really arching our back. So when I get set up, what I like to do is take a big breath in through my nose. Now my belly's full of air, but notice I'm not valsalvaing, I'm not bearing down. I can still keep that tension in my midsection. And then I like to reach toward the floor to kind of feel my lats engage. And then I'm trying to pressure my feet into the ground to kind of get stability through my hips by squeezing my big toe into the ground and almost screwing my feet into the ground slightly. Now from there, I'm gonna hinge and I'm grabbing the bar. And I like to squeeze that bar as hard as I can so I get as much recruitment as possible. And then when I stand up, I wanna cue squeezing my butt to finish with hip extension and not lumbar extension, okay? Notice how I kept a double chin throughout the entire duration of that movement. So I'm not staring at myself in a mirror because I don't want to get a bunch of cervical spine extension. So double chin, I'm going to go from the top. So big breath in through my nose, belly's full of air, creating expansion through my midsection. Now my spine is relatively stable. I'm going to reach toward the ground to get my lats and chest to fire. I'm going to hinge through my knees, kind of screw my feet into the ground, press my big toe into the ground, squeeze the bar as hard as I can. Double chin, stand up, squeeze, finish the movement with my butt, not my low back. Okay, and now the last piece of that is your bar path. I just like telling people, drag the bar up your shins, up your knee, up your thigh. That way the bar is tracking close to you. If you want to get really technical, you can videotape it. And the bar path should be relatively straight with minimal front to back sway.